Hello and welcome to this YouTube video from Health Plus about the tips to keep your prostate healthy. The prostate is located just below the bladder and in front of the rectum. The prostate is about the size of a walnut and surrounds the urethra, that is, the tube that empties urine from the bladder. The primary function of the prostate is to produce the seminal fluid that nourishes and transports sperm. The prostate also plays an important role in hormone production. The prostate also helps to regulate urine flow. As a man ages, the prostate tends to increase in size. Thus, prostate problems are common, especially in older men. Enlarged prostate occurs approximately in 30% of men over 50 years and at approximately 90% of men aged 80 years. In this video, we will discuss tips to keep your prostate healthy as you get older. First is maintaining a healthy weight. Obesity is linked to prostate health issues. According to WebMD.com, obesity may increase your risk of developing aggressive, fast-growing form of prostate cancer that is more difficult to survive from. By maintaining a healthy weight, you may be able to lower your risk of prostate cancer. Secondly, we will discuss certain foods that are deemed to be beneficial to your prostate health. Prostate Cancer Foundation recommends the following 5 foods to help promote the health of your prostate. Colorful vegetables such as kale, cauliflower, Brussels sprouts, broccoli. Also berries, cooked tomatoes, certain fish like salmon, red snapper, coffee, and tea. The Science of Living Well Beyond Cancer recommends a diet that is high in colorful vegetables, low in sugar and processed carbohydrates, and moderate in animal-based protein. Certain foods, such as foods rich in saturated animal fat, such as red meat, should be avoided. Also, avoid sugar and processed carbohydrates. These food categories can increase insulin resistance, increase inflammation, raise cardiovascular risk, and be a part of a dietary pattern that may lead to obesity. Next, it is important to get tested and for you to know your risk level. Beginning at age 45, men should get a digital rectal examination, known as DRE, and prostate-specific antigen, known as PSA test. These tests help to check for risks of prostate cancer. These tests are recommended especially if you're African American or have a family history of prostate cancer. These tests should be conducted annually. During a digital rectum test, your doctor inserts a gloved, lubricated finger into the rectum and feels the back wall of the prostate gland for enlargement, tenderness, lumps, or hard spots. The prostate-specific antigen PSA test is a blood test that measures the amount of prostate-specific antigen in your blood. The next tip is to exercise regularly. Exercise has been shown to be beneficial to the overall well-being of adults in numerous ways. There's research showing that regular exercise helps prevent prostate issues such as benign prostate hyperplasia, BPH, commonly known as prostate enlargement, prostate cancer, and erectile dysfunction. Various types of exercises can be helpful for men with prostate problems. One of the recommended exercises is Kegel exercise. According to Mayo Clinic, Kegel exercise for men can help strengthen the pelvic floor muscles, which supports the bladder and bowel and affects sexual function. Other exercises such as walking, jogging, and swimming are also beneficial. These exercises, in addition to other aerobic exercises, can help maintain a healthy weight, which we have stated earlier in this video to be beneficial to prostate health. The 6th tip we recommend is to hydrate daily. Drinking a lot of water is one of the ways of enhancing your metabolism. Doctors recommend drinking 6 to 9 glasses of water, about 1.5 to 2 liters of water every day. Drinking a lot of water may help your prostate both directly and indirectly. Drinking a lot of water helps keep the body hydrated, boost your metabolism, and slow aging. However, limit water intake before going to bed at night to prevent waking up at night to urinate repeatedly. Dehydration can cause a decrease in urine volume, which can lead to problems with the prostate gland. The prostate can become enlarged and cause problems with urine flow. In the 7th tip, we recommend that you manage stress. Stress and enlarged prostate go hand in hand. The more stressed a man becomes, the worse the man's enlarged prostate symptoms. Similarly, the worse a man's enlarged prostate symptoms get, the more stress the man feels. Stress affects hormones that trigger prostate enlargement. When your body is stressed, it releases more of the cortisol hormone. In men, cortisol suppresses other key hormones such as testosterone. As your testosterone level drops, the level of estrogen increases. Increased level of estrogen in men indirectly promotes the growth of prostate cells, resulting in an enlarged prostate. Secondly, stress increases the rate of conversion of testosterone to dihydrotestosterone, DHT. DHT is the central hormone responsible for growth of the prostate both in puberty and young adulthood, approximately at age 25. When an increased level of DHT accumulates in the prostate, it triggers rapid cell growth and development. Very high levels of DHT resulting from extreme prolonged stress causes prostate enlargement. Stress also depletes zinc. Zinc is a critical mineral for the prostate. Stress triggers the release of increased quantities of adrenaline. Adrenaline triggers contraction of muscles of the prostate and bladder. As a result, the prostate causes the urethra to narrow, making passing urine more difficult and painful. Our eighth and final tip is to stop smoking. According to the Journal by American Association for Cancer Research, cigarette smoking may increase the risk of prostate cancer by affecting circulating hormone levels or through exposure to carcinogens. Smoking was identified to be associated with a moderately increased risk of prostate cancer in middle-aged men between ages 40 and 64 years. There's also a dose-response relationship that exists between the number of pack, years smoked, and cancer risk. In conclusion, we highlighted that it's important to maintain a healthy weight, get annual examination to determine your risk level, exercise regularly, hydrate daily, manage stress, cease smoking, as some of the tips that will help men aged 45 years and older to keep their prostate healthy. Please watch our video of Top 5 Foods for a Healthy Prostate for more details on certain foods that are beneficial. You can find the link below. If you enjoyed this video, please don't forget to hit the like button. Also, hit the subscribe button to follow this channel for more interesting adult health topics.